Before taking Zeposia, make sure to read the medication guide provided by your pharmacist and ask your doctor or pharmacist if you have any questions. Take each capsule by mouth with or without food as directed by your doctor, usually once a day or every other day. Swallow the capsule whole. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. Take this medication regularly to get the most benefit from it, and try to take it at the same time every day. Do not increase your dose or take this medication more often than prescribed. It won't improve your condition any faster, and it will increase your risk of side effects. Do not stop taking this medication without consulting your doctor, as stopping suddenly could make your condition worse. Make sure to report any new or worsening symptoms right away. The manufacturer recommends avoiding certain foods and beverages that are high in tyramine while taking Zeposia, as they may increase your blood pressure. These include aged cheeses, dried/aged meats and sausages, preserved fish, products with large amounts of yeast, fermented foods, most soybean products, broad/fava beans, red wine, sherry, tap beers, vermouth, and others. Ask your doctor or dietitian for more details and for a list of foods to limit or avoid. If your condition gets worse, be sure to tell your doctor. Possible side effects of taking Zeposia Starter Kit: 0.23 mg, 0.46 mg, 0.92 mg capsules in a dose pack include back pain, dizziness, and lightheadedness. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. When you first start taking this medication, you may experience temporary slowing of your heartbeat. Your doctor may slowly increase your dose during the first 8 days of treatment to decrease this risk. It's important to remember that the benefit of taking this medication outweighs the risk of side effects for most people. Zeposia Starter Kit may also raise your blood pressure and can rarely cause serious liver disease. It can also weaken your immune system and increase the risk of infection, so it's important to watch out for any signs of infection and to not start this medication if you already have an infection. Additionally, there is a risk of getting a rare but very serious brain infection, so it's important to seek medical help if you experience any new or worsening symptoms that have lasted for several days. In case of very serious side effects or a serious allergic reaction, seek medical help right away. And if you notice any other effects not listed, contact your doctor or pharmacist. Always consult your doctor for medical advice about side effects. Before starting Zeposia, it's important to let your doctor know if you have any allergies or if you have a history of certain medical conditions, such as breathing problems, diabetes, heart issues, high blood pressure, liver problems, or if you smoke. This medication may also cause dizziness, so it's best to avoid alcohol or marijuana while taking Zeposia. Zeposia may increase your risk of getting infections or worsen current infections, so it's important to stay away from people who have contagious illnesses. It's also important to discuss your vaccine history with your doctor and ask if you need any vaccines before starting treatment. If you do need a live vaccine, it should be given at least 1 month before starting Zeposia. If you are planning to have surgery, make sure to let your doctor or dentist know that you are taking Zeposia. It's also important to discuss with your doctor if you are pregnant or planning to become pregnant, as Zeposia may harm an unborn baby. If you are breastfeeding, consult your doctor before using Zeposia. When taking Zeposia, it's important to be aware of potential drug interactions. Certain medications may change how Zeposia works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Some products that may interact with Zeposia are other drugs that weaken the immune system or increase the risk of infection, such as natalizumab, rituximab, and alemtuzumab. Additionally, it's important to avoid taking any MAO inhibitors during treatment with Zeposia. This includes medications like isocarboxazid, linezolid, and selegiline. Most MAO inhibitors should also not be taken for 2 weeks before and after treatment with Zeposia. It's important to consult with your doctor about when to start or stop taking this medication. It's important to discuss any potential drug interactions with your healthcare provider to ensure the safe and effective use of Zeposia. If someone has taken too much of the Zeposia starter kit and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., residents can call the local poison control center at 1-800-222-1222, and in Canada, residents can call their provincial poison control center. It's important not to share this medication with anyone else. Before starting and while taking this medication, your doctor may want to do some lab or medical tests, such as a complete blood count, blood pressure check, pulse check, EKG, MRI, eye exams, liver function tests, and lung/breathing tests. It's important to attend all of your medical and lab appointments and consult your doctor for more details. Make sure to follow your treatment schedule as prescribed by your doctor. If you forget to take a dose of Zeposia during the first 14 days of treatment, you may need to start at a lower dose and gradually increase it again. If you miss a dose after the first 14 days, just skip the missed dose and take the next dose at your regular time. Do not take a double dose to make up for the missed one. It's important to ask your doctor in advance what you should do if you miss a dose of Zeposia. It's important to store the Zeposia starter kit at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, be sure to properly discard the product. You can consult with your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.